Hello everyone. Welcome to Enzyme MBBS, where complex medicine becomes simple and exam ready. Okay, without wasting any time, let's get started. So, coming to the introduction, wound healing is a highly regulated biological process involving inflammation, cell proliferation, extracellular matrix deposition, and tissue remodeling. This entire process we have discussed in the process of wound healing. When any of these phases are disturbed, exaggerated, or insufficient, wound healing becomes abnormal, leading to various complications of wound healing. Very straightforward definition. Something is normal. If it is disrupted, it becomes abnormal, and abnormal leads to complications. So, these complications may result in delayed repair, excessive scar formation, functional impairment, or cosmetic deformities. Okay, I hope that is clear. Now, coming to the classification of complications of wound healing. So, there are four types. One is deficient healing, then excessive healing, abnormal wound contraction, and chronic non healing wounds. Now, let's see one by one. So, coming to the first type, that is deficient wound healing. As the name suggests, deficient healing occurs due to inadequate formation of granulation tissue or collagen, leading to failure of wound closure. We know that for healing of wound, we basically need granulation tissue, we need collagen synthesis, right? So, if there is inadequate formation of granulation tissue or collagen, it results in deficient wound healing. So, there are two types under this. One is wound dehiscence and one more is ulceration. So, coming to the wound dehiscence, the definition wound dehiscence refers to partial or complete separation of wound edges after they have been surgically closed. We talked about this in proper wound apposition in the video factors promoting a delayed wound healing. Basically, we need correct alignment of wound edges. But in dehiscence, what happens? It is complete separation. The wound edges are separated even after surgically it has closed. So that results in delayed wound healing, and it also results in deficient wound healing. So causes for this are infection, increased mechanical stress. Now, increased mechanical stress may be happening due to coughing, vomiting, and abdominal distension. Poor suturing technique or malnutrition, diabetes mellitus, prolonged steroid therapy. We talked about this, that corticosteroids, the anti-inflammatory drugs, they basically delay the wound healing, and they may also result in inadequate formation of granulation tissue or collagen, which results in deficient wound healing and a type wound dehiscence. Then pathogenesis, here extensive collagen degradation happens and inadequate collagen synthesis. If you carefully think in the scar remodeling or tissue remodeling, whatever, in that basically collagen type 3 is degraded and collagen type 1 is synthesized. But here collagen degradation is extensive, but the synthesis of collagen is inadequate, and there is also a prolonged inflammation. That's why in the causes we wrote infection. If there is a persistent infection, there will be prolonged inflammation, so that can also be a pathogenesis. So here basically inadequate collagen synthesis happens, so there is a wound dehiscence, and the clinical significance of this is commonly seen after abdominal surgery, and it may lead to evisceration. Now, what is evisceration? It is basically protrusion of abdominal organs through an open surgical wound. Now you may ask, then is it hernia? See, there is a difference between hernia and evisceration. Hernia, it is basically protrusion of an organ through a natural or acquired defect in the body wall, whereas evisceration happens through an open surgical wound. That is the difference. Okay, so here it is commonly seen after abdominal surgeries, and it may lead to evisceration, and it requires urgent surgical intervention. Next, coming to the ulceration. Ulceration, it is the failure of re-epithelialization leading to persistent open wounds. Now, in the process of wound healing, we discussed a phase where we said it as epithelialization, where the basal cells proliferate and migrate and epithelial cells comes. So we basically need, and contact inhibition is lost. All this we discussed. We basically want more and more cells. But here there is a failure in this process which leads to the inadequate production of collagen. Okay, so and it also results in inadequate angiogenesis, and there is a failure of epithelial migration here. So common sites where it occurs in lower limbs and pressure points. Causes poor blood supply, diabetes mellitus, venous insufficiency, and prolonged pressure such as bed sores. Bed sores, if you see some old persons who are persistently lying in the bed, who are bedridden, in their body, if you observe the back after few weeks or some 20-25 days, there are some sores which have been resulted due to prolonged pressure, because they don't move in the bed, and the pressure is applied in some particular points, and that results in the bed sores. So this is also one cause. The pathology is persistent inflammation, inadequate angiogenesis, and failure of epithelial migration. So this is the first type. Now coming to the second type, it is excessive wound healing. First type was deficient wound healing, where there was inadequate synthesis of collagen. Whereas in excessive wound healing, this results from overproduction of collagen and ECM, leading to abnormal scar formation. Okay. So here also there are three types. First type is hypertrophic scar. So hypertrophic scar is an excessive accumulation of collagen at the site of injury, confined within the boundaries of original wound. This sentence is very important, because hypertrophic scar always, it is confined within the boundaries. It doesn't cross the boundary of original wound. Okay, it will be present inside the boundary of the original wound. So characteristics are, it is raised and firm scar, and it develops within weeks of injury and often regresses with time. With time it goes down or it regresses. The pathogenesis here is excessive collagen synthesis, increased TGF beta, that is transformation growth factor beta activity, and decreased collagen degeneration. See, in defective, collagen degeneration was more and collagen synthesis was less. Here collagen synthesis is more and collagen degeneration is less. Next, second type under excessive wound healing is keloid. Now observe the definition. A keloid is a pathologic scar characterized by excessive collagen deposition extending beyond original wound margins. There it was within the boundary, here it crosses the boundary. It goes out of the boundary of the wound. That is the basic difference between hypertrophic scar and keloid. The features of keloid are, it is firm, shiny, nodular lesion, does not regress spontaneously, and high recurrence rate after excision. What is excision? Excision is basically surgical removal. Imagine there is a keloid, it has been removed surgically, but after few months or few days, it reappears. The chance of recurrence is very high in keloid. So the predisposing factor here is genetic susceptibility, and the common sites where you can observe keloid are earlobes, chest, and shoulder. The pathogenesis here is excessive fibroblast proliferation, increased type 3 collagen synthesis, increased growth factor activity. So some examiner also want you to mention the difference between hypertrophic scar and keloid. So that's why I mentioned it in a tabular column. If you see, the basic main difference is extent. One is confined to wound, one is extent beyond wound. Regression, hypertrophic regresses usually, but keloid does not regress. And recurrence, hypertrophic scar is rare. It won't recur again after the excision. But keloid, commonly it recurs. And collagen hypertrophic scar, it is increased, but in keloid it is markedly increased. The third type under excessive wound healing is exuberant granulation tissue. The exuberant word stands for excessive. So here there is excessive granulation tissue. So the definition is exuberant granulation tissue refers to excessive formation of granulation tissue that protrudes above level of surrounding skin. So effect is prevents reepithelialization and delays wound closure. Management is surgical excision or cauterization. Now cauterization, it may be a new term for you, but it basically stands for, it is a medical procedure in which tissue is destroyed or burned using heat, electricity, or chemicals to stop bleeding, remove abnormal tissue, or prevent infection. Here it is basically abnormal tissue, right? Exuberant granulation tissue. Next, coming to the third type, that is abnormal wound contraction, which is basically known as contractures. Now definition, contractures are excessive wound contraction leading to deformity and functional impairment. The mechanism of this is excess activity of myofibroblast and excessive collagen deposition. If you remember, in the process of wound healing, we discussed the contraction of wound. The contraction of wound basically happens with a specialized fibroblast called as myofibroblast, which has actins. So here, basically, abnormal wound contraction, if it is happening, it is due to the excessive activity of that specialized fibroblast, that is myofibroblast. So excessive collagen deposition happens here also, and common situations are extensive burns and healing by secondary intention. Now again, healing by secondary intention is separate 5-mark question. We will discuss in another video. Clinical importance of this is restricts movement, causes cosmetic deformity, and it is common around joints. The fourth type is chronic non-healing wounds. So characteristic is persistent for months or years. Anything chronic, it obviously persists for months or years. Failure to progress through normal healing stages. The causes are recurrent infection. It's like you're progressing something, and again infection repeats. So again you will step back. So that's what happens here. Recurrent infection. One more is ischemia, diabetes mellitus, repeated trauma, pressure source. All these will result in chronic non-healing wounds. And then just write about systemic and local factors contributing to complication. That is basically delaying. It's nothing but already a video has been uploaded on this. Just mention a chunk of it. That is local factors: infection, poor vascular supply, foreign bodies and excessive movement; systemic factor, malnutrition, old age, diabetes, steroid therapy, immunosuppression. If you not watched that video, please go and watch. You will be clear with it. And at last, write the clinical significance. That is delayed healing increases the morbidity. Morbidity is nothing but a diseased condition, a bad condition of the body. And one more is hospital stay. Hospital stay obviously will increase if healing is prolonged, and there is a risk of infection. There are a variety of infections which you can get from even the hospitals. We call it as hospital acquired infections. So the risk of that infection also increases, and risk of infection of wound also increases because there is a delay in healing. So it is a double risk. Then excessive scarring leads to cosmetic issues. Obviously, the scar in face or anything, people don't like it, right? It is cosmetically they have a problem. And one is functional disability. If the wound is present in some vital places, or where you do more work, and it basically pains, so there is a functional disability. And early identification prevents severe complications. So that's all about the video. I hope this was helpful for you, and if you like the video, it was helpful, please